Hey there, future nurses and midwives. Welcome back to AfroNurse Academy. I am so glad you're here with us today because we're about to dive into one of the most fascinating and absolutely essential systems in the human body, the urinary system. Now, before we get started, I need to tell you something important. This is the very first lesson in our Anatomy and Physiology 2 course. And if you haven't watched the course outline video yet, please pause right now and go check that out. It's the very first video in this playlist, and it gives you a complete roadmap of everything we'll be covering in this course. Think of it as your study guide, your navigation system for this entire journey. Once you've watched that outline, come right back here and we'll jump in together. So what exactly are we covering today? We're going to break this down into 3 major parts. First, we'll look at the organs of the urinary system. We'll talk about each organ, the kidneys, the ureters, the urinary bladder, and the urethra. And we'll understand what each one does and why it's designed the way it is. Remember our golden rule from Anatomy and Physiology 1? Structure and function always go together. Second, we're going to dive into the physiology of urine formation. This is where things get really interesting because we'll see how your kidneys, these 2 bean-shaped organs, filter about 180 liters of blood every single day and turn it into just 1 to 2 liters of urine. We'll break down the 3 main processes: filtration, reabsorption, and secretion. Don't worry if those words sound intimidating right now. By the end of this video, you'll understand exactly what they mean and why each one matters. And third, we're going to talk about fluid, electrolyte, and pH balance. This is where the urinary system shows its true genius because it doesn't just remove waste, it's constantly monitoring and adjusting the chemistry of your blood to keep everything in perfect balance. We'll see how your kidneys help regulate how much water is in your body, how they balance important electrolytes like sodium and potassium, and how they keep your blood pH in that narrow, healthy range. So buckle up, grab your notes, and let's explore the urinary system together. Let's start with the big picture. The urinary system, also called the renal system, that's because renal means relating to the kidneys, consists of 4 main organs. You have 2 kidneys, 2 ureters, 1 urinary bladder, and 1 urethra. Now, the primary job of this entire system is to filter blood, remove waste products and excess substances, and eliminate them from the body as urine. But as we'll see, these organs do so much more than just waste removal. Let me paint you a picture of where everything is located. Your kidneys are positioned at the back of your abdominal cavity, 1 on each side of your spine, roughly at the level of your lower ribs. They're retroperitoneal, which means they sit behind the peritoneum. That's the membrane that lines your abdominal cavity. The right kidney is usually slightly lower than the left kidney because the liver, which is a large organ, sits above it and pushes it down a bit. This is actually important to know when you're examining patients or looking at imaging studies. From each kidney, a tube called a ureter carries urine downward to the urinary bladder. The bladder sits in your pelvis, right behind your pubic bone. It's like a muscular storage bag that holds urine until you're ready to release it. Then, from the bladder, 1 final tube called the urethra carries urine out of the body. Now, the length of the urethra differs between males and females, and this difference has important clinical implications that we'll touch on later. Alright, let's zoom in on the kidneys, because these are the real superstars of the urinary system. Each kidney is roughly the size of your fist, about 10 to 12 centimeters long, and shaped like a kidney bean, which is where that bean got its name from, not the other way around. They weigh about 125 to 170 grams each, which isn't very heavy, but don't let their small size fool you. These organs receive about 20 to 25% of all the blood your heart pumps out. Think about that for a second. Your kidneys make up less than 1% of your body weight, but they get a quarter of your blood supply. That tells you just how important their job is. If you were to cut a kidney in half and look at its internal structure, you'd see three main regions. The outer layer is called the renal cortex. Cortex means bark or outer layer. So this is the outer portion. Beneath that is the renal medulla, which contains cone-shaped structures called renal pyramids. And then there's the renal pelvis, which is a funnel-shaped cavity that collects the urine and funnels it into the ureter. Now, I know these names might feel like a lot, but stick with me because understanding this structure will help you understand how urine is actually made. Inside the cortex and medulla, you have the functional units of the kidney, and these are called nephrons. This is a word you absolutely need to know and remember. Each kidney contains about 1 million nephrons, and each nephron is like a tiny filtration and processing unit. The nephron has several parts. It starts with a structure called the glomerulus, which is a ball of tiny blood vessels or capillaries surrounded by a cup-like structure called Bowman's capsule. From there, the filtered fluid flows through a series of tubules. The proximal convoluted tubule, then the loop of Henle, which dips down into the medulla and comes back up, then the distal convoluted tubule, and finally into a collecting duct that carries urine toward the renal pelvis. Now, I know that's a lot of anatomy, but here's why it matters. Each part of the nephron has a specific job in filtering blood and making urine. The glomerulus does the initial filtering. The tubules reabsorb the good stuff your body wants to keep and secrete additional waste products. And the collecting ducts fine-tune the final urine composition. We'll get into the details of these processes in just a bit. The kidneys have three major functions, and you need to know all three. First, they filter waste products from the blood. Things like urea, which comes from protein breakdown, creatinine from muscle metabolism, and uric acid from nucleic acid breakdown. These waste products would be toxic if they built up in your body, so the kidneys remove them. Second, the kidneys regulate fluid and electrolyte balance. They control how much water you retain or lose, and they balance electrolytes like sodium, potassium, calcium, and phosphate. And third, the kidneys help regulate blood pressure and produce important hormones. They make erythropoietin, which stimulates red blood cell production. They activate vitamin D, which is essential for calcium absorption. And they produce renin, which is part of a system that regulates blood pressure. Moving down from the kidneys, we have the ureters. These are two muscular tubes, one coming from each kidney, and they're about 25 to 30 centimeters long. Their job is simple but important: transport urine from the kidneys to the bladder. Now, you might think, okay, it's just a tube. Gravity does the work, right? Well, not exactly. The ureters have smooth muscle in their walls, and this muscle contracts in waves, a process called peristalsis. You might have heard this term when studying the digestive system because the intestines also use peristalsis to move food along. In the ureters, these wave-like contractions push urine downward toward the bladder, even if you're standing on your head. Gravity helps, but the peristalsis is what really gets the job done. The ureters enter the bladder at an angle. And this is actually a really clever design feature. When the bladder fills up and its walls stretch, this angular entry point creates a valve-like effect that prevents urine from flowing backward into the ureters and potentially back up to the kidneys. This is important because if urine were to flow backward, it could carry bacteria up to the kidneys and cause a serious infection called pyelonephritis. So this simple anatomical arrangement serves as a protective mechanism. Next up is the urinary bladder, and this organ is basically a temporary storage tank for urine. It's a hollow, muscular organ that sits in your pelvic cavity. When it's empty, the bladder is quite small and its walls are thick and folded. But as it fills with urine, it can expand significantly. The bladder wall contains a special type of tissue called transitional epithelium, and this tissue is stretchy, allowing the bladder to expand as it fills. An average bladder can comfortably hold about 400 to 600 milliliters of urine, though it can stretch to hold more if needed. The bladder wall has 3 layers of smooth muscle, collectively called the Detrusor muscle. When you urinate, this muscle contracts to squeeze urine out. At the base of the bladder, where it connects to the urethra, there are 2 sphincters or rings of muscle that control urine release. The internal urethral sphincter is made of smooth muscle, and it's involuntary, meaning you don't consciously control it. It stays contracted to keep urine in the bladder. The external urethral sphincter is made of skeletal muscle, and it's voluntary, meaning you can consciously control it. This is what gives you the ability to hold your urine even when your bladder is full, or to release it when you decide it's time to go. The process of urination, which we call micturition in medical terms, involves a coordinated reflex. When your bladder fills to a certain point, stretch receptors in the bladder wall send signals to your spinal cord and brain. Your brain then decides whether it's an appropriate time to urinate. If it is, signals are sent back that cause the detrusor muscle to contract and the internal sphincter to relax. You voluntarily relax the external sphincter and urine flows out through the urethra. If it's not a good time, your brain can override the reflex and keep the external sphincter contracted. This voluntary control is something we learn as children during toilet training. Finally, we have the urethra, which is the tube that carries urine from the bladder to the outside of the body. Now, the urethra is quite different in males and females, and this difference has important clinical implications, especially when we're talking about urinary tract infections. In females, the urethra is relatively short, only about 3 to 4 centimeters long. It opens to the outside just above the vaginal opening. Because it's so short and because it's close to the anal area where bacteria naturally live, women are much more susceptible to urinary tract infections than men. Bacteria have a shorter distance to travel to reach the bladder. This is why you'll often advise female patients about proper hygiene, wiping from front to back after using the toilet, staying hydrated, and urinating after sexual intercourse to help flush out any bacteria that might have entered the urethra. In males, the urethra is much longer, about 18 to 20 centimeters. It passes through the prostate gland and then through the penis before opening at the tip. The male urethra serves a dual purpose. It carries both urine and semen, though not at the same time. The length of the male urethra provides better protection against urinary tract infections, which is why UTIs are less common in men. However, the fact that the urethra passes through the prostate gland means that if the prostate becomes enlarged, which often happens as men age, it can squeeze the urethra and make urination difficult. Alright, now that we understand the anatomy, let's talk about the physiology. How exactly is urine formed? This is where we really see the genius of the kidneys. Urine formation involves three main processes: glomerular filtration, tubular reabsorption, and tubular secretion. Let me break down each of these for you. First is glomerular filtration, and this happens in the glomerulus, that ball of capillaries we talked about earlier. Blood enters the glomerulus under high pressure, and this pressure forces water and small dissolved substances out of the blood and into Bowman's capsule. This filtered fluid is called filtrate, and it contains water, glucose, amino acids, vitamins, minerals, urea, creatinine, and other small molecules. Large molecules like proteins and blood cells are too big to pass through the filtration membrane, so they stay in the blood. This is important because if you find protein or blood cells in someone's urine, it's a sign that something is wrong with their kidneys, specifically with the filtration membrane. The kidneys filter an enormous amount of blood. They process about 180 liters of filtrate every single day. Now, you might be thinking, wait, we don't urinate 180 liters a day. That's correct, and that's where the next process comes in. The second process is tubular reabsorption, and this is where the kidneys reclaim all the good stuff that your body needs. As the filtrate flows through the tubules of the nephron, about 99% of it gets reabsorbed back into the blood. Let me say that again because it's remarkable. Of those 180 liters filtered daily, about 178 to 179 liters get reabsorbed. Only about 1 to 2 liters actually become urine and leave your body. So what gets reabsorbed? Almost all of the glucose gets reabsorbed in the proximal convoluted tubule. This is why healthy people don't have sugar in their urine. If you do find glucose in the urine, it usually means either blood glucose levels are so high that the tubules can't reabsorb it all, like in diabetes, or there's a problem with the reabsorption mechanism itself. Almost all of the amino acids are also reabsorbed because your body needs these to make proteins. A large amount of water is reabsorbed, and this amount can be adjusted based on your body's hydration status. Important electrolytes like sodium, potassium, calcium, and chloride are also reabsorbed, and the amounts reabsorbed can be regulated based on what your body needs. The proximal convoluted tubule does most of the reabsorption, reclaiming about 65% of the filtered water and sodium, plus nearly all the glucose and amino acids. The loop of Henle plays a crucial role in concentrating urine. The descending limb is permeable to water, so water leaves the filtrate, and the ascending limb pumps out sodium and chloride, but it's not permeable to water. This creates a concentration gradient in the medulla that allows the kidneys to produce concentrated urine when your body needs to conserve water. The distal convoluted tubule and collecting duct do the final fine-tuning of reabsorption, and this is where hormones really come into play to regulate how much water and electrolytes are reabsorbed. The third process is tubular secretion, and this is where the tubules actively move substances from the blood into the filtrate. Why would we need this if we've already filtered the blood in the glomerulus? Well, some substances don't get fully filtered out, or the body produces them after filtration has occurred. Secretion provides an additional way to remove these substances. What gets secreted? Hydrogen ions are secreted, and this is crucial for regulating blood pH. Potassium ions are secreted in the distal tubule and collecting duct, which helps control potassium levels in the blood. Certain drugs and toxins are also secreted into the tubules, and ammonia, which is produced by tubule cells from amino acids, is secreted to help buffer excess acid. Secretion also allows the kidneys to respond quickly to changes in blood chemistry. For example, if your blood becomes too acidic, the tubules can secrete more hydrogen ions to remove that excess acid. If you eat a meal high in potassium, the tubules can secrete more potassium into the urine to prevent blood potassium from getting too high. So, to summarize urine formation, filtration removes water and small solutes from blood, reabsorption reclaims the good stuff you want to keep, and secretion adds additional waste and excess substances. The end result is urine, a solution that contains waste products and excess substances your body needs to eliminate. Now, let's talk about how the urinary system maintains fluid, electrolyte, and pH balance, because this is where you really see the sophistication of these organs. Your body is about 60% water, and that water is distributed between different compartments: inside cells, outside cells, in the tissue fluid, and in the blood plasma. The amount of water in each compartment needs to be carefully regulated, because if there's too much or too little water in any compartment, cells can't function properly. The kidneys regulate water balance through their ability to produce either dilute urine when you have excess water or concentrated urine when you need to conserve water. This is controlled primarily by a hormone called antidiuretic hormone, or ADH, also called vasopressin. Here's how it works. When your blood becomes too concentrated, meaning you're dehydrated, special sensors in your brain detect this. Your brain then releases ADH from the posterior pituitary gland. ADH travels through the blood to the kidneys, where it makes the collecting ducts more permeable to water. This means more water gets reabsorbed back into the blood and you produce a small amount of concentrated urine. On the flip side, when you drink a lot of water and your blood becomes too dilute, ADH secretion decreases. The collecting ducts become less permeable to water, less water is reabsorbed, and you produce a large amount of dilute urine. Now, let's talk about electrolytes. Electrolytes are minerals in your body that have an electric charge, and they're absolutely essential for nerve function, muscle contraction, maintaining proper hydration, and many other processes. The main electrolytes your kidneys regulate are sodium, potassium, calcium, and phosphate. Sodium is the most abundant electrolyte in the blood and tissue fluid, and it plays a huge role in regulating water balance and blood pressure. The kidneys control sodium reabsorption primarily through a hormone called aldosterone. When blood sodium is low or blood pressure drops, the kidneys release an enzyme called renin. Renin triggers a chain of reactions that eventually produces angiotensin II, which then stimulates the release of aldosterone from the adrenal glands. Aldosterone tells the kidneys to reabsorb more sodium, and water follows sodium, so blood volume and blood pressure increase. This whole system is called the renin-angiotensin-aldosterone system, or RAAS, and you'll hear about it a lot in your studies because it's crucial for blood pressure regulation. Potassium balance is also critical because too much or too little potassium in the blood can cause dangerous heart rhythm problems. The kidneys regulate potassium by adjusting how much is secreted in the distal tubule and collecting duct. Aldosterone also increases potassium secretion. So when aldosterone levels rise to conserve sodium, potassium excretion increases. This is why certain blood pressure medications that affect the RAAS can alter potassium levels, and patients taking these medications need to have their potassium monitored. Finally, let's talk about pH balance. The pH scale measures how acidic or alkaline a solution is, ranging from 0, which is very acidic, to 14, which is very alkaline, with 7 being neutral. Your blood pH needs to stay within a very narrow range, between 7.35 and 7.45. Even small deviations outside this range can be dangerous. If blood pH drops below 7.35, you have acidosis. If it rises above 7.45, you have alkalosis. Both conditions can interfere with enzyme function, oxygen delivery, and electrolyte balance. Your body produces acid constantly through normal metabolism. When you break down proteins, you produce acidic waste products. When you exercise, your muscles produce lactic acid. Even just breathing produces carbonic acid. So your body has several buffer systems to handle this acid. And the kidneys play a vital role in long-term pH regulation. Here's how the kidneys regulate pH. First, they can reabsorb bicarbonate, which is a base that neutralizes acid. The proximal tubule reabsorbs most of the filtered bicarbonate, preventing you from losing this important buffer in your urine. Second, the tubule cells can secrete hydrogen ions directly into the urine. This removes excess acid from the blood. And third, the kidneys can produce and secrete ammonia, which binds to hydrogen ions in the urine, helping to eliminate acid while conserving bicarbonate. The beauty of renal pH regulation is that it's adjustable based on your body's needs. If you eat a high-protein diet, which produces more acid, your kidneys will secrete more hydrogen ions and produce more ammonia. If your blood becomes too alkaline, perhaps from excessive vomiting which causes you to lose stomach acid, your kidneys can reduce hydrogen ion secretion and excrete more bicarbonate in the urine to bring pH back down. Now, I need to mention that the lungs also play a role in pH balance by controlling carbon dioxide levels. But the lungs respond quickly, within minutes, while the kidneys provide slower but more sustained pH regulation over hours to days. The two systems work together to maintain that critical pH range. Understanding fluid, electrolyte, and pH balance is absolutely essential for your nursing practice. When you're caring for patients, you'll frequently monitor things like urine output, blood electrolyte levels, and arterial blood gases to assess pH. You'll administer IV fluids to correct imbalances. And you'll need to understand how the kidneys respond to different conditions. For example, a patient with kidney disease might not be able to excrete potassium properly, so you'd need to monitor their potassium levels carefully and possibly restrict potassium in their diet. Or a patient with severe vomiting might develop metabolic alkalosis, and you'd need to understand how their kidneys will try to compensate. Let me give you a few quick clinical connections to show you how all this applies to your future practice. When you see a patient with edema, that's swelling from fluid accumulation in tissues, you need to think about what might be going wrong with their fluid balance. Are their kidneys retaining too much sodium and water? Is their heart not pumping effectively, leading to fluid backup? Understanding how the kidneys regulate fluid helps you understand why we give diuretics, medications that make the kidneys excrete more water to treat edema. When you measure someone's urine output, you're not just checking a box on a chart, you're assessing kidney function. An adult should produce at least 0.5 milliliters of urine per kilogram of body weight per hour. If output drops below this, we call it oliguria, and it might indicate kidney problems, dehydration, or shock. If someone stops producing urine altogether, That's anuria, and it's a medical emergency. When you collect a urine sample for analysis, you're gathering valuable information: the color, clarity, specific gravity, which tells you how concentrated it is, pH, and presence of substances like protein, glucose, blood or white blood cells all provide clues about what's happening in the kidneys and the rest of the body. A simple urinalysis can help diagnose urinary tract infections, kidney disease, diabetes, liver problems, and many other conditions. And when patients need dialysis because their kidneys have failed, understanding what healthy kidneys do helps you understand what dialysis is trying to replace. Dialysis filters waste products and excess fluid from the blood. It balances electrolytes and it helps regulate pH. But it can't do everything kidneys do. It can't produce erythropoietin or activate vitamin D, which is why dialysis patients often need medications to replace these functions. All right, let's wrap up what we've covered today. We started by exploring the 4 main organs of the urinary system: the kidneys, which filter blood, regulate fluid and electrolytes, and help control blood pressure; the ureters, which transport urine from the kidneys to the bladder through peristaltic contractions; the urinary bladder, which stores urine until it's convenient to release it; and the urethra, which carries urine out of the body, with important differences between males and females that affect infection risk. We then dove deep into the physiology of urine formation, breaking it down into 3 processes: glomerular filtration, where blood is filtered under pressure and water and small solutes move into Bowman's capsule; tubular reabsorption, where about 99% of the filtrate is reclaimed, including water, glucose, amino acids, and electrolytes; and tubular secretion, where additional waste products and excess substances are actively moved from blood into the urine. Finally, we explored how the urinary system maintains fluid, electrolyte, and pH balance. We talked about how ADH regulates water balance, how aldosterone and the RAAS regulate sodium and potassium, and how the kidneys handle acid-base balance through bicarbonate reabsorption, hydrogen ion secretion, and ammonia production. These regulatory functions are absolutely critical because even small imbalances can have serious consequences. I hope you can see now why the urinary system is so much more than just a waste removal system. It's a sophisticated regulatory system that keeps your internal environment stable despite constant changes in what you eat, drink, and do. This concept of maintaining a stable internal environment is called homeostasis, and the kidneys are one of the most important organs for achieving it. So what's coming next? In our next video, we're going to shift gears completely and talk about the integumentary system. That's your skin and all its associated structures like hair, nails, and glands. You might think, what's there to learn about skin? But trust me, the integumentary system is absolutely fascinating. It's your largest organ. It's your first line of defense against the outside world. It helps regulate temperature. It synthesizes vitamin D. And it provides such important information during physical assessment. We'll cover the layers of skin, the functions of each layer, and how to assess skin integrity, which is such a crucial nursing skill. You won't want to miss it. Before you go, let's do our usual routine. If this video helped you understand the urinary system better, if things clicked into place that didn't make sense before, please hit that like button. It helps us reach more nursing and midwifery students across Africa who need these resources. And if you haven't already, subscribe to AfroNurse Academy and turn on those notifications so you never miss a lesson. We're building something special here, a complete educational resource for African nursing and midwifery students, and you're part of this community. Drop a comment below and let me know, what was the most interesting thing you learned about the urinary system today? Or is there any part you'd like me to explain further? We read every comment, and your feedback helps us create better content for you. And as always, share this with your classmates and study partners. Education is better when we learn together.